Welcome back. I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We're going to be learning a little bit about a couple of the finalists in the Health Value Awards, and Edward Smith is here of Health Tree Benefits and Consulting. Welcome.
I'm glad to be here with you.
Now, Edward, you submitted a couple of your clients for these awards. You were very impressed with the kind of progress they made. One, a 10-year case study, and another client, a 2-year case study. What stuck out in your mind about what was happening with them that would be appreciated by the audience here?
Yeah, I'm happy to tell you a little bit more about them. So the 10-year case study was a college client of ours, and over 10 years they've held their healthcare spend to 4.2% trend, right, as compared to 10 to 12%. So right now their medical and prescription drug expense is running about half the national benchmark. So I was pleased that they were able to hold that over 10 years, kind of a longitudinal study.
Okay.
And then the 18-month case study that I submitted for the Health Value Awards is the city of Moultrie, which is a small municipality client of ours. And really what we did there was kind of a cost reset, if you will. And so when we first met with the leadership of the city, they were in, I think it would be fair to say, desperate times. The city manager made the comment to me that, Edward, we need to lower our cost by 20-25%, or I'm going to have to raise the millage rate. So we took a kind of an all-out approach to do that. At the time, their health care benefits accounted for about 22% of their general budget, right, at about $2.8 million. And so that's running $18,000 per employee per year for this small municipality. After the first year, we were down to about $11,000 per employee per year.
Okay.
And through the first 6 months of the current year, we're at $6,500 per employee per year.
Wow.
So now they're running about 9.5% of their budget. So from 22% down to 9.5%. And the city manager still has his job.
I mean, that's dramatic. Yeah. I mean, what did you do?
It has been traumatic. You know, we really instituted kind of the blocking and tackling of cost containment. So making everything transparent with all the various personas and components of the health plan, and customized all the components inside the health plan. So everything from networks with direct contracting to the PBM contract, and it created a dramatic effect. So we're pleased.
What was attractive to the partners that came aboard to work with this municipality? Why was it interesting to them to maybe be a little bit more flexible on what they were charging for services?
Sure. You know, there are, throughout the healthcare ecosystem, all of the various entities, whether you're a provider or a TPA or consultants or all of the entities, so many are kind of struggling in this dysfunctional system, in the dark, if you will. And if you show them a sliver of light, you know, that where the patient can get a better medical outcome for a lower cost and don't have to worry about financial ruin, they really will step up to the plate. Most folks struggle inside kind of that dysfunctional system, but they want to do the right thing. And so our role is just to be a guide, a facilitator of helping these various partners do the right thing and be effective in cost containment ultimately for the payer.
Okay. You worked in financial services before starting HealthTree 10 years ago.
That's correct.
Were you prepared for the things that you were learning once you stepped over to working in healthcare?
I think being coming out of business school and being a financial analyst in the banking industry was actually maybe counterintuitively good training for what I'm doing now, to really take a financial analytic approach to healthcare. The ability to kind of continually peel back that onion to see what the financial mechanisms and motivations are within the structure, I think has been helpful. It's certainly been enjoyable for me to do something that has such a great impact on people's lives is to help them get better medical outcomes and not have to worry about affordability issues.
Shocked in any way by what you discovered in the healthcare area once you really touched it closely and deeply?
I'm consistently shocked at the waste that occurs inside our healthcare system. I think it's Jeff Bezos from Amazon that says, you know, your margin is my opportunity. Well, there's a lot of opportunity in healthcare, in the healthcare space, and that's because there's such abundant waste.
Okay.
So,
and what specifically?
well, I mean, you can take your pick, but prices of medical procedures are far higher than they should be, and that's because of the pricing mechanism that we've created, or the structure is created, where we're sending money to carriers who are then paying it to providers and contracts that the purchaser can't see. Mm-hmm. Pharmacy is rife with waste, whether it be generics or specialty drugs, and so these are, and all this is occurring inside kind of a black box. Or the metaphor I like to use is that the patient and the payer seem to be on this train, right, going through a long, dark tunnel at a high rate of speed. They're being pulled by this engine toward, poor medical outcomes without any real financial control. And so our job is to try to shed some light and provide some options inside that structure, which is not always easy.
Sure. Now, Edward, have you been to the World Healthcare Congress before?
I have. I was here last year.
Okay, that's right. We spoke last year. Tell me what you're getting out of the meeting so far.
Oh, it's been a fantastic day. We've been talking really about today about what levers need to be pulled, or what message needs to be communicated for employers to begin to seriously consider what they might see as out-of-the-box solutions now. So how do we get our message out? And I think some of the conclusions we're coming to is that will be more easily done as word gets out. So when you have an employer in a given geographic location that's paying, $5,000 or $6,000 per employee per year, and down the road you have an employer that's paying $13,000 or $14,000, so half, that becomes a competitive advantage inside an industry. So that municipality who's now down in the $6,500 range, that's a $1.6 million in taxpayer savings that they can put toward other priorities for that city. So.
All right. Edward Smith of Healthtree, thank you.
Thank you so much, Mabel.
And I'm Mabel Jong. Thank you. Stay tuned. More content to come.